Lemonade sparkles, I love that. Can hernia repair itself in men? No, it cannot. What a hernia is a defect in the abdominal wall. The most common area for men is in the groin area, either the left side or the right side, sometimes both. And it's at the point where muscle tissue is covered with a covering that's kind of like saran wrap called fascia. And then when the muscle is no longer there, the fascia comes together and attaches to the bone to hold that muscle in place. And there's usually some slippery substances in there to keep the muscle sliding back and forth so it doesn't generate heat from your normal body movements. So you can, when that happens, you get a defect in the muscles, and that defect is a hole, usually where the fascia attaches to the muscle or someplace where it's thinned out. Once that hole is there, it will not repair itself because fascia is not a tissue that is restorative. Once it has a hole in it, it has to be fixed. And so people can get them in their belly button. You can have an umbilical hernia. You have heard of innies and outies. If a person is an adult and they have an outie, they have an umbilical hernia that needs to be fixed. I used to do that procedure. You kind of create a little smiley face incision at the bottom of the umbilicus or the belly button. You sew it with some sutures. Now they're putting mesh in some people as well. So the mesh will help stabilize so that it doesn't reopen and tear. But this is a surgical problem. While you're sitting there talking about it, it's best to do it versus it becoming an urgent problem, because that hole will allow a loop of intestines to come out. Now, if that loop of intestine goes back and forth, that's called a sliding hernia. That's okay. But if it ever comes out and gets stuck or twist on itself, now you have a bowel obstruction and you have a medical emergency that literally worsens on a minute to minute basis. So if you can get it fixed by choice, i.e., you go to the doctor, he confirms you actually do have a hernia, and then says, okay, we can fix this on Friday. You come in Friday morning, you'll be home by lunchtime, you'll be totally healed in a week or two, and the only restriction will be no heavy lifting or something like that. Then you have a good, quick, and easy recovery. If it ruptures, then you got a disaster. It's kind of like you got piece Humpty Dumpty back together again. You have all these pieces of tissue. You either have to pull it back together or cut out. And once you cut out, then you got to close that gap. And so that becomes what would have been a minor surgical procedure now becomes a much more aggressive surgical procedure, or even a major surgical procedure if you get a loop of intestines trapped in that hernia. That loop of intestine dies. They have to cut out that bad piece of intestines and then reconnect the ends of the intestines. Oftentimes, people will have leaking, with problems associated with it, and so it's best to just do it while everything is just a hernia, and that's the only problem. And so you need a general surgeon is the person that will do that. You can get evaluated by a primary care doctor, your family doctor, or your internist, who can refer you to a surgeon, and the surgeon can take care of that for you. They're using laparoscopic techniques now, meaning they have to make fewer little tiny incisions. You don't get big scars all over yourself. And it's very, I won't say it's minor surgery. I had a patient educate me. I was explaining to him. I say, oh, it's just a minor surgical procedure. And he said to me something that was very profound. He stopped me, looked me in the eye, and said, Dr. Collier, there's no such thing as minor surgery when you are the person being operated on. And I said, you know what? You're absolutely correct. That was the greatest, most profound statement I had heard. So I utilize that now. So I never say minor surgery. I just say less invasive or minimally invasive, or something that you can recover from very quickly. Great question, Lemonade Sparkles. We appreciate you.